Is Plan N's lower premium a smart move or a costly mistake when compared to Plan G?
These appear to marry each other quite closely. On both of these plans, you're going to have to pay your Part B deductible. The good news is that Part A deductible, that's covered. This is just your Part B, the $256. So you'll see Part B coinsurance. The way that the Plan N is structured is you would pay up to $20 when you go see a doctor for your Part B coinsurance, the doctor side of things, and you would pay up to $50 if you're in the emergency room. Now, if you're admitted, it goes into a hospital stay, there's a whole lot there. But that is one factor here that helps to reduce that premium, is your Part B excess charges. Let's go ahead and dive into the main pros and cons of these plans. Plan G, this is the most comprehensive coverage you can get. It covers your Part B excess charges, those co-pays. There is a high deductible Plan G available. The monthly premiums are much lower on this plan, but that deductible is $2,800. So that's pretty significant. A lot of times when people start to talk about that plan, they start to just consider Medicare Advantage instead. But there's a right plan for everyone, and everyone's needs are slightly different. Now, the cons of Plan G, if it's one of the most comprehensive plans, it's going to be one of the highest premiums. So now looking at Plan N, the pro is the lower monthly premium. We looked at some general supplements and we kind of averaged it out that you would see around $120 a month for a Plan N. Now, this is around a 65-year-old, and of course it varies depending upon where you live. But we're seeing about $150 per month for a Plan G. So in average, it was between $30 and $50 less a month for that Plan N versus that Plan G. The cons are, what do you do with that $30 to $50 you're saving? You're going to go ahead and pay for some of the co-pays for your doctor's visit, or if you're going to the emergency room. It does not pay Part B excess charges. You could face underwriting if you're switching from an N plan to a G plan at a later point. Generally, if you're going from a higher plan like a G down to an N, it's a little bit of a different situation. Neither plan covers your Part D drugs. You're going to have to still purchase that plan. Neither plan covers dental, vision, or hearing. Long-term care, so your nursing home element, your skilled nursing care and rehab, that would be covered the same as any Medicare supplement would cover. And last, private duty nursing, if you're getting something on your own or having someone come in to help you. On the flip side, though, the similarities are, these are really strong coverages. These are great plans. It just depends on your specific needs. You're still going to have to pay your Part B premium regardless of which plan you're on. And you're also going to have to pay your Part B deductible, that $257. And at the end of the day, it covers the out-of-pocket max that original Medicare leaves behind. So you know you're protected. Really, you can't go wrong either way. It sort of depends on which plan works better for your particular situation. If you have a question, give us a call. This is all we do, and we're happy to help.